So what I'd like to focus on are past global outbreaks of respiratory diseases and possible future ones. The past ones are primarily the SARS coronavirus that began in 2002 in Southeast China in Guangdong province and then spread to about 29 countries by 2003, largely through plane travel. And then 2009, the pandemic of influenza virus, a different family of viruses, influenza viruses, called H1N1 that began in Mexico and quickly spread around the world over a couple of months, again, primarily through people traveling on planes who had the virus. And then in terms of future potential global or regional, global, or national outbreaks, I would like to speak about a newly discovered virus, which is also in the family of coronaviruses, like the SARS coronavirus, but it's not SARS, it's a different kind of coronavirus. And it was discovered just last year in 2012 here in the Middle East. Again, it has been found in a small number of patients so far in the Middle East, and in a traveler from the United Kingdom who went back to the UK in February of this year and transmitted the virus to 220 numbers, one of whom unfortunately died. For reasons of time, I won't go into the brand new this month, reported for the first time from China, a different kind of flu or influenza virus called H7N9. But I do have a few what I call backup slides, and so in the course of the half-hour discussion, if anyone wants to ask about the H7N9 virus from China, I'll be happy to talk about that. It's a rapidly evolving situation with now over 100 people with that virus, and 20 of them have died. Again, that's all been just in the course of the past 3.5 weeks. So to start off with the SARS coronavirus of 2002, 2003 in China. SARS itself is an acronym for Severe Acute Respiratory Syndrome. Basically describes what happens. It comes on quickly. It's very severe. It has about a 10% case fatality rate, meaning of the approximately 8,000 people who were diagnosed with SARS virus pneumonia, lung infection in 2003, 100 of them died, so about 10%. Again, in the autumn of 2002, but quite possibly earlier. That's just the earliest patient that we've been able to identify. There's no antiviral drug treatment, either then or today. Not for the SARS coronavirus and not for the new coronavirus discovered in the Middle East last year. By the first half of 2003, the SARS coronavirus had spread to 29 nations on 5 continents. How does the SARS coronavirus and the new coronavirus in the Middle East get transmitted to humans? Is there an animal reservoir? Does the infection come from animals? Initially, SARS coronavirus, the answer is clear. That is that the virus exists in certain bats, and then the bats transmit the virus to what we call an intermediate host, an intermediate animal. In this case, it was an animal called a civet cat that is, I understand, a culinary delicacy, if you will, not only in China and Hong Kong, but Vietnam and other parts of Asia. And it's a civet cat that was infected that then transmitted the virus to humans. And then the virus mutated and was able to transmit through the air from person to person to person to person. And that triggered the international outbreak or epidemic of SARS in 2003. Reasoning by analogy to 10 years later, basically, 2012 and now 2013, the novel coronavirus found in the Middle East, in at least 4 nations in the Middle East so far, is thought to originate in bats. By genetic sequencing, it's very similar to coronaviruses that are known to exist in bats. Not identical, but very, very similar. However, so far, this new coronavirus from the Middle East hasn't been found, at least it hasn't been made public. If it has been found, I'm not aware of it. It's not been found to exist in bats or in any other animals. So one of the most key fundamental questions is, how do people get infected? We don't really know as of today. But suspicion is very high that originally the virus reservoir. It exists in bats, certain species of bats. And it most likely infects some other animal, which then through close contact with that animal, people become infected. So in 2003, I went to Guangdong province in southeast China to this hospital, Sun Yat-sen University, a Department of Infectious Disease, a very, very large hospital, to learn more about what happened with the SARS outbreak that year. And I traveled with the physician on my right in the picture, Dr. Wu from Hong Kong. And on my left is Dr. Deng Zai, who works in this hospital. And he was one of the younger members of the infectious disease faculty. So in the autumn of 2002, he was sent by his senior mentors, if you will, to go out into the countryside to investigate these rumors of a new pneumonia that was going on. Go out, find out about it, come back and tell us about it, give a PowerPoint presentation. This is a very large department of infectious disease doctors, more than 50 doctors and more than 100 nurses. And so they sent basically the youngest man in the department out to the countryside because the SARS virus didn't start in the big cities, it started in smaller areas in Guangdong province. So as he related to me, he went out in November and December and he looked far and wide for this new virus, and he said he thought he saw a few patients with it, but overall he wasn't very impressed or very worried, he said, because it didn't really seem to be spreading very much, and some people got quite sick, but most didn't seem to. And so he came back and gave his PowerPoint presentation towards the end of December in 2002, and everyone sort of breathed a sigh of relief. Good. So this virus isn't that bad. And the government at the time actually, the Chinese government stated that the cause of the virus was a bacteria, a particular kind of bacteria called chlamydia, which can cause pneumonia sometimes. Unfortunately, it didn't turn out to be accurate. It wasn't a bacterial pneumonia, it turned out to be a new virus, the SARS coronavirus. And also, very unfortunately, Dr. Deng Zai became very, very ill towards the end of January with the SARS virus, and he had to be on a breathing machine and almost died. And the reason is that the virus came to their hospital. So they're in the capital, Guangzhou, Guangdong province in southeast China, a big referral hospital for infectious disease. So as the virus between November, December, and January must have mutated and became able to transmit from person to person to person to person much more easily than it could when he was out in the countryside in November and December. And as happened in every single city where there was a large outbreak of SARS coronavirus in 2003, there was a patient who had the viral pneumonia, who came to a hospital, wasn't able to breathe on his own or her own, and had to be put on a breathing machine if one was available. And the process, a tube is put into the person's throat and airway, the trachea, so that it could be artificially or mechanically ventilated. But in every single city, the same thing happened, where it was very difficult sometimes to put a person onto a mechanical breathing machine when they're gasping for breath. And so in the process, more and more doctors and nurses come in to try to help to get the patient onto a mechanical ventilator. And by and large, it wasn't the standard practice to wear masks or gloves or eye protection at that time, including in the United States for patients who needed to be put onto a breathing machine. So what happened was a person with this new SARS coronavirus pneumonia is coughing, sneezing, and basically exposing many people to what I like to call shared breathing space. Doctors and nurses, other healthcare professionals. And so the virus was transmitted to them. Often it was more than 10 people who were infected, and the World Health Organization coined the term super spreader or super spreading event for when one patient transmitted the virus and the infection to more than 10 people. So that's what happened in this hospital, Sun Yat-sen University Hospital in Guangzhou, the beginning of Chinese New Year, the end of January of 2003. Doctors who became one of the patients. So the situation in 2002 is that there were only sporadic cases in China of SARS coronavirus. It wasn't very contagious. But then something happened, it changed, the virus changed, and it began to trigger outbreaks in hospitals and then outside the hospitals as well. February of 2003. Then what happened was things changed radically the pace of this epidemic of SARS accelerated greatly. And honestly, in my view, this wasn't something that could have been predicted. I think the Chinese government had received at that time, did receive a lot of criticism, and they've come under a lot of scrutiny in the past month for how they're handling the H7N9 virus emergence in China, and because of what happened with SARS in 2003. However, in my opinion, it's very difficult to predict brand new contagious infectious disease when it first starts, from causing only sporadic cases, not very contagious, to suddenly now it's very contagious and it's spreading quickly in cities. And what happened was one of the physicians in Guangzhou, taking care of the patients who had SARS, decided to go to a wedding in Hong Kong. Now, he did have a cough and a little bit of a fever, but he had convinced himself that he didn't have the new pneumonia. He wasn't that sick, he said, and he said, still going to the wedding, and the family wanted him to come to the wedding, and it was at the Metropole Hotel in Kowloon in Hong Kong. And he stayed there only one night, February 21st of 2003. Unfortunately, he did have SARS. Fortunately, he was very contagious. Known as a super spreader, he infected more than 10 people. In fact, 16 people who were staying in the hotel. No one who worked there, but 16 people who were staying there over the course of really 24 hours. One night is all he stayed there. 4 of the 16 people he infected then went on to different cities, Hong Kong being one, Hanoi another, Singapore another, and Toronto, Canada. They triggered large outbreaks of SARS, starting in hospitals when they themselves became very sick and had to be hospitalized. So the outbreaks were triggered by people who were staying in the hotel, who then flew out of Hong Kong. Hong Kong, as you know, is a very large airport hub, business center, and traveler center in Asia. And so there was a businessman, an American-Chinese businessman, who flew on from Hong Kong to Hanoi. He'd been at the Metropole Hotel, triggered an outbreak in a particular hospital in Hanoi. Similarly, there are 3 airline attendants from Singapore who went back home. 2 of them didn't spread the virus to anyone. One spread to 22 other people. Triggered the outbreak in Singapore. And then there was a lady in Canada from Toronto who was staying at the hotel, and she got infected, flew home to Toronto, and triggered a large outbreak there, as well as infecting several family members. So again, I want to emphasize the rapidity with which this virus changed to be able to be transmitted easily from person to person to person, and triggered outbreaks largely through airline travel, with Hong Kong being the perhaps predictable, high on the list airport where many international travelers come in and then go out around the world. I went to visit, as Mahan mentioned, during SARS. I saw these pictures on the BBC and CNN, and read about it in the Washington Post every day and the New York Times, and I thought, this is history. This is history. I had to look there for myself to see it. And it really was history. Everyone was wearing masks in the malls and the taxis. The airport was almost empty. It was severe financial losses that were incurred in Hong Kong and Singapore, Beijing, Guangzhou, Toronto. But I'd like to emphasize now is that, again, this concept that one person could infect a lot of other people. And conversely, most people with the SARS virus infection didn't infect anyone else. And we still today, 10 years later, don't understand why that is. Why are there some so-called super spreaders that infect 10 or more people, but the majority of people with SARS coronavirus don't infect anyone? And that's something that was seen multiple times in Hong Kong. Here is in Singapore, and this is the picture that says of the 238 people with SARS in Singapore, basically they could all be traced back to 5 people, 5 so-called super spreaders, almost all. And patient number 1 here is one of the flight attendants who came back from the Metropole Hotel with the virus. very small. Let me just talk my way through this for you, this graph. It's from the U.S. Centers for Disease Control. On the y-axis is the number of people who had SARS coronavirus in Singapore. And on the x-axis is the number of people who were infected by someone else. So what I would like to call your attention to is that 160 people with SARS in Singapore out of approximately 238 or so did not infect anyone else. So again, the majority of people did not infect anyone else. And it was only a small number, about 5 people, who transmitted the virus to a large number of other people. And only about 19 people transmitted the virus even to one other person. So I'm trying to build the case here that we know what happened with SARS coronavirus 10 years ago. We know that this happened. It's an observation. But we don't know why. And it would remain perhaps only a historical curiosity. And it may still do so. But in my opinion, it's a very important precedent. Sort of past is prologue. Past is prologue. Potentially for future outbreaks of respiratory diseases, particularly contagious ones, and particularly other coronaviruses. In my view, that's exactly the situation that we are seeing today in the Middle East with the new coronavirus. It's mildly contagious. It's so far only infected a small number of people, but the potential is there for a small number of individuals to infect a lot of other people. And in a few slides, I'll present the case to you that I think that has already happened, that there was a single person who infected more than 10 other people with this new or novel coronavirus in the Middle East. In just a minute. So that's why I'm trying to dwell a bit on SARS coronavirus as the past for what's now beginning to happen with the coronavirus in the Middle East. I also had the good fortune to be able to go work in Canada during SARS. Having come back from Hong Kong, the Canadian government invited people healthcare workers to come from the UK and the US to help with the outbreak there. So I went to Scarborough General Hospital, and in Canada the outbreak was triggered by, as I mentioned, the patient, the lady who came back from Hong Kong. Unfortunately, she passed away. She transmitted the virus to her son. He passed away after going to the hospital, and there were several other people in the emergency room that he was around. No one was wearing a mask, and their names are abbreviated: Mr. P, Mr. D, and as you can see, they, or Mr. P's spouse, infected more than 10, in fact more than 20, 30 other people in hospitals in Toronto. So it's really the same theme over and over. What happened in Guangzhou, happened in Hong Kong, happened in Hanoi, happened in Singapore, happened in Toronto. Hopefully that won't happen with the novel coronavirus in the Middle East. But I think it's prudent to be vigilant and to be prepared. So in going in to see patients in the intensive care unit, there was a very strict protocol that to protect healthcare workers that had been developed long before I got there. But this is what I had to wear with the assistance of someone basically dressing me, because there was a very strict sequence in which you had to put on all this protective equipment, and then a very strict sequence on how it had to be taken off to minimize the risk of inadvertently getting infected with the SARS coronavirus. So just a couple minutes, I'd like to now go on to from 2003 to 2009. Now we have another contagious respiratory virus that traveled, in this case, really all around the world, not just 29 countries and 5 nations like SARS did. But this is a new or novel influenza virus, as you all recall, called H1N1. This one began not in Asia, but in Mexico. Probably began in February. But it was really recognized towards the end of April, about this time, 2009, 4 years ago, around April 25th. But I do want to emphasize also that much like the SARS coronavirus that started in the autumn of 2002, but really wasn't recognized until March of 2003, the pandemic flu virus wasn't recognized till late April, but it started in February. And so again, I want to emphasize that as new virus epidemics occur, they had to start somewhere. And the sooner we can recognize them at the start, the more likely we can stop them, or at least mitigate their serious effects, serious in terms of public health, serious in terms of economic impact. Again, rapid global spread of this new influenza virus due to people traveling around the world on planes who had the infection, often didn't know it, hadn't developed symptoms yet. And the pandemic of influenza was declared on June 11th by the World Health Organization, WHO. The pandemic is a schematic. It travels around the world. The influenza pandemics do very quickly. And this is a picture of a report in the World Health Organization bulletin just came out last month of plane travel from Mexico. You can see direct flights to Shanghai and to Tokyo, as well as to several places in Europe and South America and North America, including the United States. It's stated in this report by Dr. Khan and colleagues from last month that each year more than 700 airlines transport over 2.5 billion travelers, 4,000 airports. So for someone with my background, I wonder why aren't there more respiratory epidemics around the world with so many travelers? But fortunately, there are not. There was a big seminar that was put on by the National Academies of Science, the Institute of Medicine in the United States, basically trying to address this very complex issue of infectious disease spread or movement in a borderless world. And that applied not only to infectious disease of people, but of animals. And about 2/3 of all new infectious diseases of humans over the last 30 years have originated in animals. So again, going on now from past global outbreaks, the SARS in 2003, pandemic flu in 2009, to the novel coronavirus here in this region that was first recognized last year, and again, most recently last month in a patient from Abu Dhabi, UAE. So what we know so far is limited, but this is it, as far as I know it. First outbreak of this new virus that occurred, although it wasn't known at the time because there were no tests for a new undiscovered virus at the time, was exactly 1 year ago, last April. Zarqa, northern Jordan, north of Amman. About 11 or 12 people became very sick, mostly nurses, a couple of doctors, and 2 family members of nurses. They all worked in the intensive care unit. Unfortunately, 2 of the 11 or 12 people died. So for me, right away, this reminded me of SARS in hospitals in Guangzhou, and Hong Kong, Hanoi, Singapore, and Toronto. And it turned out that, in fact, this virus is a coronavirus, same family as the SARS coronavirus, but it wasn't discovered, if you will, until a patient in Saudi Arabia became very sick in June. Not in Jeddah, he was hospitalized there, and it's frequently said that he was from Jeddah, but he wasn't. He's from a place to the south called Bisha. I'll show a map in just a second. And this new virus was first reported on an international website called ProMed on September 20th of 2012. Subsequently, since September of 2012 until last month, there have been a small number of patients from here, others from Saudi Arabia, and as I mentioned, from Abu Dhabi and the UAE. In addition to the family, 3-member family in the UK and Philippines. I'll talk a little more detail now before I finish the presentation about these patients. So totally, there have been laboratory diagnosed confirmed 17 patients. Remember, this is a brand new test. It's not generally available. In the United States, it's only available at the Centers for Disease Control in Atlanta. I'm honestly not sure if anyone's been tested for the virus in my country. They may have been, but I haven't heard of some patients. So in Saudi Arabia, there have been 9 laboratory confirmed patients. And speaking with Minister of Health, Dr. Ziad Mamouche in Saudi Arabia, I think they're looking very comprehensively now for this virus and people who have severe pneumonia and don't have a very severe form. UK, I mentioned the 3 patients in one family. Jordan, the 2 patients who died had samples, whether it was from the sputum or the lungs or the blood, I'm not sure, that were saved. And when the virus was discovered and first reported in September, the Ministry of Health, I think, did a very good thing in Jordan. They took the samples and sent them back to the same original lab where they had sent them in April to be tested to figure out what caused this epidemic or this outbreak in Zarqa Public Hospital. And at that time, no diagnosis could be made in April, but now when they were sent back in October, the diagnosis was made. It was this new coronavirus. But again, there were 9 more people and they were tested also, but now this was 6 months later, and they had recovered, they were well, so you wouldn't expect them to be positive in the virus test. So the World Health Organization calls them probable cases of the novel coronavirus. The Ministry of Health did call in the World Health Organization from the Eastern Mediterranean Regional Office here, EMRO, and the headquarters to do a joint investigation of what happened in Zarqa. November, and they posted the results of their investigation on the WHO's website, 21st of December. About that in just a second. In addition, here in Qatar, there have been 2 patients, one of whom had traveled to Saudi Arabia, so it wasn't entirely sure whether he got the infection there or here. But the second patient last October, as best as is known in the published report that came out, he had not traveled out of Qatar. And recently, last month, one patient from UAE and Abu Dhabi. This is from a paper that was published in the Saudi Medical Journal by Dr. Ziad Mamouche and colleagues, Dr. Al-Barak, who's an infectious disease doctor I met in Riyadh a couple of years ago. They point out just the basic geography of most of the cases in Saudi Arabia and in Riyadh, or an area I think is about 200 kilometers away, Al-Qasim. But the first patient was from Bisha and was transferred to a hospital in Jeddah. He wasn't someone who lived in Jeddah. So 1 year ago, April 20th, that's 2012, so 1 year ago, the Jordan Times newspaper had a series of articles on 3 consecutive days, April 20th, 21st, and 22nd. This was the first one with this picture in the newspaper article, and it said, Zarqa Hospital Intensive Care Unit ICU closed after nurse dies from infection. It wasn't an infection, and in fact, it was due to this new virus that hadn't been discovered. The Jordan Times, and I quote here, the Ministry of Health on Friday closed the intensive care unit at the hospital that's believed to be the source for an infectious disease that affected a number of staff working in the hospital. So I think the Ministry of Health responded very quickly, and they did send the samples from the 11 patients to the World Health Organization Collaborating Center, which is in Cairo, to be tested for all known respiratory virus infections, bacteria, viruses, fungal infections, what could have caused pneumonia in so many people working in an intensive care unit. So to me, it certainly implied that likely there was person-to-person-to-person transmission. It's not formal proof, but to me, it's very likely. It's very likely. Well, the report that I mentioned on the 21st of December on the World Health Organization's webpage, they have a special webpage on the coronavirus now, the new coronavirus. It basically reported the following. They were unable to identify who the first patient was. In other words, how did the virus get into the intensive hospital even? There's no link to travel, as there was for some other patients, for example, from here and from UAE or elsewhere. And there's no link to animals. Some of the other patients had exposure to animals, goat or camels or potentially some other animals. None of these 11 people had any link to animal exposure. And finally, the report states that there's no method of exposure found. So what I interpret that to mean is they weren't sure if it was person-to-person spread or how the 11 people got infected. So it's, in my view, in my experience, an unusual kind of report. You know, you have some of the very best epidemiologists and doctors, public health officials, imaginable from the Ministry of Health in Jordan and the World Health Organization, but they weren't able to solve the mystery of how did this virus get into the hospital. This is the link for anyone who wants to read the full report. So my question before I close and open up for discussion and comment is the Middle East coronavirus now, in early 2003, like the SARS coronavirus in 2002 in terms of only causing sporadic infections and only rarely causing person-to-person transmission, with the only definitive proof that there was person-to-person transmission being taken as the UK traveler who went in February to visit family in Pakistan and then to Saudi Arabia and then came home to the UK and transmitted the virus to 2 family members, neither of whom had traveled outside of the UK. One of whom died, one of whom had a very mild pneumonia. Furthermore, I'd like to open for discussion later as question, is the hospital outbreak from last April in Zarqa like hospital outbreaks in the early part of 2003 in Southeast China, for example, in Guangzhou, the hospital I mentioned at Sun Yat-sen University. And similarly, looking ahead, hopefully this would never happen, but I think it's prudent to anticipate what could happen and what could or should perhaps be done to increase our vigilance and or to mitigate problems as quickly as possible once they're recognized. So I'd ask, will the new coronavirus travel, if you will, via Middle East airport like the SARS virus traveled in 2003 via the Hong Kong airport? In summary, I think there are several, and I'll emphasize two potential lessons from the 2002-2003 SARS coronavirus epidemic for the 2012-2013 new coronavirus reported from 4 countries in the Middle East so far, as well as a traveler in the UK. I would argue that hospital outbreaks are an early warning or a red flag, if you will, particularly when there's a we call a cluster of 5 or 10 or more people, healthcare workers, perhaps 1 or more patients, and then particularly family members of healthcare workers, which means the virus is being transmitted outside of the hospital. That's certainly what happened everywhere in the world where there were SARS outbreaks a decade ago. So, as I mentioned, this is why my attention was focused and remains focused on what happened a year ago in the hospital in Jordan. Secondly, will there be international spread of this new coronavirus due to plane travel primarily, but really any kind of travel, like the SARS coronavirus spread internationally? And finally, again, I'd like to ask the question, what can or should be done, if anything, at this point in April or next month, in May, or in June 2013, to try to prevent or recognize as soon as possible if there are more outbreaks in the hospital or in the community of this new novel coronavirus, particularly before or at the very beginning when it seems to start to travel to other countries through travelers, through plane travel. So I'd like to stop at this point, ask for questions and comments, and thank you very much for your interest in coming.